Dr. Anatoily Ilzarov has a big job. He saves the littlest lives at McAllen Medical Center.
We're taking care of very small babies, tiny, that were born before time. The babies that need a lot of respiratory support, that they can't move air in and out on their own.
Dr. Ilzarov is the director of the Neonatal Intensive Care Unit, where several babies are born prematurely before 37 weeks of gestation each year. Most of them will have an average day of 10 to 15 days, but others aren't as fortunate.
We can have babies who are very small, as small as 20 weeks of gestation. Those babies can weigh somewhere between 400 to 500 grams and less than 1 pound. And these babies can stay as long as 3 to 4 months.
These babies tend to have greater respiratory problems and require ventilators for assistance. Dr. Ilzarov actually utilizes a high-frequency jet ventilator, a premier machine that allows for a more gentle approach.
As opposed to conventional ventilator, the jet ventilation provides very small, tiny volumes of air and allow lungs not to be destroyed by high pressures. So by doing so, we preserve babies' pulmonary architecture. The lungs don't get remodeled, and therefore babies do not develop eventually chronic lung disease.
Now, while the road to recovery is a physically grueling process for these tiny bundles of joy, it's equally as hard on their parents, who bear the emotional burden.
We talk to them on a regular basis, and most importantly, we have a computer system here where we have downloaded the most common problems and most frequent questions the parents may ask.
Questions with answers that will forever define the first weeks of their baby's life.